Hello, everybody. I'm Dr. Ambali, DM Nephrology Resident, Pushpagiri Institute of Medical Sciences, Tiruvalla, Kerala. I'm also a member of the Win Icon 2024 social media team. So, as a part of the pre-Congress interview series of Win Icon 2024, today we have with us one of our esteemed international faculty, Dr. Samira Bell. So, a hearty welcome to you, Dr. Samira. So,
Thank you. I'm delighted to be speaking at this very exciting meeting.
yeah, so for the benefit of our audience, could you please say a few words about yourself?
Yeah. So I'm Samira Bell. I'm a nephrologist in Dundee, Scotland. I'm also a clinical academic doing research mainly in acute kidney injury using large linked healthcare data sets.
Okay. So thank you so much, Dr. Samira, and it's a privilege to have you with us at WinIcon 2024. So I have a couple of questions for you. Can you briefly tell us what inspired you to do research in AKI and what are the emerging areas of research in AKI?
Okay, so acute kidney injury is very common. It affects a large number of patients both in hospital and out hospital and has a variety of different causes. But we know that it's associated with adverse patient outcomes. And so if we know that a good large proportion of AKI is potentially avoidable. And so if we can increase the understanding of acute kidney injury, hopefully we can then prevent it and improve outcomes for patients. So that's really what led me to be interested in AKI. In terms of emerging areas of AKI research, so I think early detection is a really important area. We rely currently globally on serum creatinine to be able to detect AKI, and that's a relatively late measure. And often by the time the creatinine has risen, it's quite late and it's more difficult then to prevent severe AKI. And so there's a lot of work going on looking at emerging biomarkers, either in isolation, but also with the advent of AI and machine learning, being able to combine these biomarkers with clinical risk prediction tools can hopefully then lead to earlier detection of AKI. And if we can detect it earlier, then hopefully we can prevent more severe AKI and again improve patient outcomes.
Okay. So thank you for your insights, Dr. Samira. So as you've published so many articles so far, it is truly inspiring for young nephrologists like me. So could you please tell us how do you manage your clinical duties and the research?
So, I mean, I think the most important thing is enjoying what you do, and it's great to have a
Okay.
balance of both, to be able to see patients and manage patients, but also have a different aspect to your job where you're doing research and you're constantly learning new things, meeting new people, and I think that's the best part of it as well. And I think as well as a female, you also have to juggle family life, home life, and it does become difficult, but I think it's actually getting opportunities like this to meet people and to learn new things that really makes it worthwhile.
That's absolutely fantastic. Thanks for your advice. So you will be in a very special session at WinIcon 2024, that's social determinants of health and AKI. So can you give us a few highlights of your talk?
Okay, so social determinants of health are very important, and in the field of AKI, there's really a lack of data looking at social determinants of health. And so what I will discuss in my talk is I will review the existing evidence in this area, but also I will discuss a wide variety of social determinants of health and how these can impact an AKI. So that would be environment, poverty, gender, race, and many, many more. So it is a really important field. And I think if being able to understand and also to be aware, then again, hopefully we can prevent AKI in these settings.
All right. So thank you so much, Dr. Samira, for spending your valuable time with us today and sharing a glimpse of your talk at WinIcon 2024. And we're extremely excited to have you with us there and to hear more from you during the conference. So dear friends, if you're listening to this interview, I would like to remind you that Dr. Samira's session on social determinants of health and AKI is scheduled on 4th August 2024 from 10:30 a.m. to 11:30 a.m. at Hotel Mascot, Trivandrum. So we look forward to seeing you all there. Thank you.
Thank you very much, and thank you very much for the invitation. I'm very excited to be there and look forward to it.
Yeah, thank you, Dr. Samira. So see you there.
Okay, thank you.
Yeah, okay.